The World Health Organization says Southeast Asia has the highest rates of tobacco use, but it expects the rates to decline in the next few years. It sees the Western Pacific region, including China, overtaking Southeast Asia. WHO also says the number of men using tobacco is on the decline worldwide. It attributes the downward trend to the introduction of stricter tobacco controls by governments.
And for more on that WHO report, Dr. Ruediger Krech from the World Health Organization and Dr. Yvette Eijk from NUS School of Public Health joins us. Thank you very much for joining us. Dr. Krech, I want to start with you. So according to the report, Southeast Asia has the highest rates of tobacco use. Why is this?
Yeah, why is this? And it's steeply declining, if I may say. And that is because policy measures have been just put in place. That means increased taxes, banning tobacco from public places, giving help for people to quit smoking. These measures now, they are effective, and now we see a steep decline.
And Dr. Eijk, have you noticed or observed sort of changes in attitudes towards smoking here in Singapore as well?
Yeah, so, I mean, I've been here for the last 10 years on and off, and my observation is that, in general, smoking is frowned upon. And it wasn't always that way, right? I mean, anti-smoking efforts have been going on since the 1970s. So I think, you know, as tobacco measures become stricter and more comprehensive, the general attitudes towards smoking also change as people become more aware that it's bad for them. And as people, you know, start to reject smoking as a social norm.
Dr. Eijk, but we mentioned there, you know, Southeast Asia overtaking, and you mentioned that there's going to be a decline. However, China is, you know, a different story there. Dr. Krech, can you hear me?
Hello? Yes, I can hear you.
Yeah, so China seems to be a different story there. Why is that the case, though?
Yeah, so in China you have very high rates of male smokers, very low rates of female smokers, and then if then the measures would be put in place, we would see a steep decrease as well.
And Dr. Krech, just to follow on with you, your thoughts on the sort of the e-cigarettes, are they included in this report? And if not, sort of what role do they play?
Yeah, e-cigarettes are included in the report. However, we cannot see any connection to this. What we know is e-cigarettes bear a lot of health risks with them. They have very negative impact on people's health as well. So it's not to think that this would be a healthier solution at all.
So, Dr. Yvette, e-cigarettes, you know, let's look at it here. Although, you know, normal tobacco cigarettes are being frowned upon, it seems that more and more people are instead now turning to e-cigarettes as an alternative.
Yeah. Yeah, this is happening in countries where, you know, the regulations on e-cigarettes are quite lax, particularly like the United States and the UK. Yeah.
So how will that actually then impact, you know, the use of smoking? How will that impact? Because smoking is still smoking, and we don't know the impacts of e-cigarettes just yet.
Yeah, it really depends on how effective they are at helping people to quit smoking, right? Because if they were, then we would expect a very steep downward trend in smoking as e-cigarette use goes up, if they are effective, right? But to be honest, the evidence on that is not quite clear at the moment. So, you know, there have been studies that have looked at, you know, whether e-cigarettes are effective in helping people quit. Some studies suggest that they're only marginally more effective than traditional aids like nicotine patches, for example. Then, you know, you've got other studies that actually suggest that e-cigarettes are harmful for quitting because, you know, a lot of the smokers that are using e-cigarettes actually use both products at the same time. They don't really quit smoking, they cut down. Yeah.
And what are the negative side effects, or what are the negative effects of e-cigarettes?
That's another question that's really out still. So, I mean, the long-term health impacts is very unclear because really we just don't know yet. We will know in maybe 20, 30 years down the line what the long-term health impact is. And this is a very important point because, you know, with smoking, when people start smoking, they don't get sick straight away. It takes several decades before they get lung cancer or heart disease. So we would expect something like that with e-cigarettes. But there have been studies that suggest they do have quite a comparable risk of cardiovascular disease compared with smoking cigarettes. Then, you know, we have cases like in the US where a lot of people are coming down with very sudden acute illnesses like this, you know, what resembles a kind of pneumonia. So almost over 2,000 people getting sick, and I think the death count is up past 50 already. So these are all linked to vaping in some way or other.
Okay, and Dr. Krech, your thoughts on e-cigarettes and what governments are going to be doing sort of going forwards? Do you see that they'll be coming more and more under the microscope as governments look to sort of clamp down on them as well?
Yeah, as Dr. Yvette said, the evidence is not quite clear yet. What we're doing at the moment at WHO is we're actually seeing the impact, the negative health impacts all around the world. We're currently analyzing this so that we're giving evidence-based advice to member states on e-cigarettes and vaping. We're hoping to come up with a report in February on this, so that gives us a clearer picture at that point. But indeed, it's important to see the long-term effects, which we cannot see at the moment because it seems it's a quite recent development, especially on vaping. So therefore, we will see evidence coming up as we go.
So, Dr. Krech, I want to talk about this report, the WHO report. Which countries have actually done very well in bringing the number of tobacco use down?
Yeah, there's 32 countries who are doing very well. Amongst them, Brazil, Turkey, Mexico, Cambodia, Australia, New Zealand, Uruguay, just to name a few. Some very good countries performing in Africa, like at Sierra Leone, Uganda, or Tanzania. These are very good examples, and especially now seeing that for the first time the number of male tobacco users going down. We see that these policies, if countries have established and control these policies, then we see a steep decline.
Thank you so much for speaking to us. We've been speaking there with Dr. Ruediger Krech, Director of the World Health Organization Department for Health Promotion, and Dr. Yvette van der Eijk from the NUS School of Public Health.